I would describe Hodgkin's as, well, the fact that everybody has lymph nodes and it's a cancer of the lymphocytes. So basically, the immune system is attacked, and we have the good cells and the bad cells, and basically everything gets attacked in that. And the lymph nodes would swell if you have, so if they get too big, that's how there's a sign that you have lymphoma.
As I understand it, the big difference between Hodgkin and non-Hodgkin lymphoma is the presence of a certain type of cell called the Reed Sternberg cell, which is present in Hodgkin lymphoma. So if when you get a biopsy done and the pathologists look at the tumor, they see the presence of Reed Sternberg cells, that's a good indication that it's a Hodgkin's disease versus non-Hodgkin lymphoma.
I think that the difference is that the Hodgkin's grows a lot slower than the non-Hodgkin's, but my doctor told me that the Hodgkin's was more difficult to treat because of that, and I didn't really understand it because in April I had just the Hodgkin's, and then by July I had a massive non-Hodgkin's tumor, and I thought, well, this is so much more aggressive. How can this be easier to treat? But they were saying because it grows quicker, it means that the chemo attacks the cells more because they're dividing so much faster. But the Hodgkin's, I suppose, because it's growing slower, it's too similar to normal human cell growth or something like that. But that's the main difference. In terms of the symptoms, they're pretty much the same, and it's the same cells that go crazy. But I think in the Hodgkin's they're called Reed Sternberg cells, which are sort of within the tumor as well, which is how they find, or how they determine what you've got in a biopsy. But that's sort of the main difference.